specifically refers to a muscular tube that begins behind the nose and ends in the neck. It is, it's throat cancers begin in this area, but head and neck cancers is a much more broad term that refers to cancers not only of the throat, but also of the voice box, of the mouth, or the oral cavity. It also may involve the sinuses or the nose. So that's a much more broad term, but many people interchangeably use them with each other.
And what brings on these cancers? Do we know a lot about what causes them?
Well, the biggest two causes have historically been alcohol use and tobacco use. We're talking about heavy drinkers who frequently consume alcohol. We're also talking about people who use tobacco products, and it's not just cigarettes, it's any tobacco product, whether it be a pipe, whether that be chewing tobacco or snuff. All of these contain chemicals that brings about the change in the lining. Now, more recently, we have seen increasing numbers of people with throat cancer who don't smoke and who don't drink. And they're likely been related to a very commonly seen virus now, the human papillomavirus, or HPV, which is responsible for growing numbers of these throat cancers.
So what do we know about the commonness of throat cancer? Like, how common is it?
Well, while considered to be a rare cancer, over 50,000 people in the US will be diagnosed this year with throat cancer, and approximately 11,000 people will die from throat cancer. Generally a little bit more common in males, and in diagnoses are primarily seen in people who are over the age of 50 years old.
And when it comes to the symptoms for this, are they easy to miss? Is it something that people do miss?
Well, it depends on what particular area is being affected. Like I mentioned earlier, there's several areas that are classified as head and neck cancers. And so if you have a painful non-healing lesion or sore in the mouth, that could represent an oral type cancer. But in the throat, you may see a painful lump. You may have difficulty swallowing. Those involving the voice box or the larynx may have, a voice change or hoarseness present. There may even be headaches. There may be earaches. So it really depends on what area is involved, will dictate the symptoms that are present.
What can you do to prevent it?
Well, unfortunately, there's not a screening test. We have colonoscopies, we have mammograms, we don't have a good screening test. But one of the best ways in which you can prevent this is not to smoke. So if you smoke, quit. If you don't smoke, don't start. And if you're going to drink alcohol, drink it in moderation, no more than 1 or 2 drinks per day. You also want to talk with your doctor about the benefit of HPV vaccinations to see whether or not that makes sense for you at your age or your life. And another recommendation is to visit your dentist regularly, because the dentist, they're going to pick up on things that you may miss. And so that's a very good way to identify if there are changes going on that you've not identified prior.
And how are they treated? How are these cancers treated, Dr. C?
A combination of either surgery, you may require radiation and or chemotherapy, and it really depends on the stage and how early you're finding these types of tumors. Some of the surgery and the radiation could be pretty life-changing. There can be parts of the airway or parts of the mouth that need to be resected, parts of the tongue that can be resected. So it can be really, really advanced surgery depending on the stage that it's found in. So early detection, like most cancers, is key. Prevention, we have limited options, but again, it goes back to doing those things: not smoking, not drinking, asking about HPV vaccinations, visiting your dentist, and really looking for signs and symptoms where they're much sooner than found.
All right, Dr. Cedrek McFadden, thank you.
Thank you.
Coming up, a new study warns the coronavirus could erase years of progress for working women. We'll explain next.